Welcome to Coruzant Technologies, home of the Digital Executive Podcast.
Welcome to the Digital Executive. Today's guest is Akilesh, Bapu, and Matthew Ko. Akilesh Bapu is the co-founder and CEO at DeepScribe. Akilesh worked as a researcher in deep learning and applications to natural language processing at the UC Berkeley Artificial Intelligence Research Laboratory, supervised by Ben Yu and Jamie Murdoch. In the course of working on his project, the automatic gene ontology annotation for PubMed articles, the Bear team reached a fundamental technology breakthrough in 2017. Where AI could previously achieve scores of 3% on medical summarization tasks, Akilesh and his research team developed a proprietary breakthrough that allowed them to achieve scores of over 54%, solving an unsolvable problem. Matthew Ko is the co-founder and COO at DeepScribe, an artificially intelligent medical scribe platform. DeepScribe produces accurate, reliable, and quick EHR-ready medical documentation simply by listening to the natural patient encounter. Well, good afternoon, Akilesh and Matthew. Welcome to the show.
Hey, Brian. Thanks for having us.
Hey, Brian. Thanks for having us.
Amazing. I appreciate both of you jumping on a podcast. Like I talked about earlier, typically I don't have two guests on the show, but this is awesome. This will certainly keep me busy. And what we want to do now is jump into the questions and ask some amazing questions to some great innovators, some great entrepreneurs, so we can turn around and share your story with our global audience. So Matthew, I'd like to start with you if we could. You've got quite the career in engineering as a consultant, and now you're a co-founder and chief operating officer for DeepScribe. Could you share with our audience the buzz around DeepScribe right now?
Yeah, sure, Brian. So, I think it's a really interesting time in medicine right now where I think a lot of the technology that we've been seeing in the space has really kind of submitted its peak. And right now, I think a lot of the advancements in voice technology and AI has really gotten to the point where it's truly able to cater to some of the most important problems that our physicians are facing today, which is clinician burnout. So, at DeepScribe, what we do is we basically automate the clinical documentation process for physicians using artificial intelligence. And I think what's really cool is, this idea has been kind of in the space for a while, and there's a lot of players and a lot of tools that, physicians use today for documentation, but nothing has really eliminated the entire burden of documentation. And with the technology that we've developed and with, the hundreds of happy doctors that rely on our product every single day, I think it's a really interesting time that everyone's seeing, technology is actually able to solve the problems that our physicians are going through.
That's awesome. And, certainly I've talked to a ton of people on this show about the technology, and a lot of it's interesting the last year about the pandemic, how much acceleration of innovation and the use of AI. And I appreciate this because I used to work in healthcare as a technology leader, and I had to deal with physicians that were frustrated with inefficiencies, whether it was in the ER or the OR or wherever. So I appreciate you all developing a platform to help make patient care safer and a lot easier for our healthcare providers. So thank you. And so Akilesh, let's move to you real quick and talk a little bit about DeepScribe. Your product DeepScribe has developed a fundamental AI technology breakthrough in 2017 for that perfect workflow medical providers embrace. Could you explain why AI summarization on its own won't save medicine?
Absolutely, Brian. I think this is a question we get a lot. And, this problem isn't a new one, right? Physicians have been struggling with documentation for ages. Ever since the advent of EHRs, it's been a struggle. And a lot of the big players in the space have looked at this problem and tried to solve it. Extracting information from a conversation and writing it into a note is not a new idea that we just came up with and implemented. It's been tried. However, people have sort of called it this unsolvable problem. And that's because purely understanding a conversation is hard enough, but then you have to concisely summarize it in a physician's own words. And then on top of all of that, you're hit with the accuracy barriers of the medical field. You can't make a medical error in the summary and have a patient, get the wrong medication or have their referring provider learn the wrong information on what actually happened. So you have that bar. And then all that considered, then you have to customize each note to the physician's own preferences or provider's own preferences. Providers have their own specific way of doing things and writing things, and they expect any sort of tool that they use to cater to that preference. And so when you put all of this together, it becomes an extremely difficult problem. And at DeepScribe, the way we sort of attack this is almost by rethinking how the note's written. So instead of trying to automate what a physician already does, we actually reinvented how the medical note's written from the ground up. So we have this DeepScribe standard format that is optimized for our data efficient algorithm and can write notes and summarize conversations at 10x to nearly 20x to 30x the data efficiency of other techniques in this field. So if you just throw the state of the art at this problem, you'll get sort of a subpar note and you'll deem it unsolvable. But with our method, you can actually get something that not only accurately depicts the conversation, but is able to be signed off and passes this quote unquote Turing test for physicians where they're actually comfortable with the robotic notes versus the notes that they wrote in the past. So that's sort of our fundamental AI technology breakthrough that we discovered in 2017. And this data efficient algorithm, along with reinventing the note, brought us to sort of where we are today.
That's awesome. And this is what excites me about this platform, the show is, I'm a technologist and chief information officer, chief technology officer, and I've been doing this a long time, especially on the healthcare side. And I couldn't be more excited about this technology that is coming out. I'm glad you all are working on this to make people's lives easier. So thank you and much kudos to you all. So Akilesh, we're going to stick to you real quick and just kind of go through maybe some of your technology. Obviously, you're leveraging some new and emerging tech with AI within that tech stack, right? Is there anything specific you might be able to share with us today?
Absolutely. So just from a bird's eye view, the workflow that physicians use with our product today is essentially this tool that they can set down in their physician-patient conversation. They'll record everything the patient and physician are saying back and forth, analyze it, and then summarize that information into a concise medical note that the physician can just view inside their own electronic medical record system. Now, this process involves various steps. First, you're transcribing the audio through speech to text, and then you're going into a natural language summarization engine, which is essentially parsing through the transcript, finding the relevant medical terms and relevant conversational pieces that back up those medical terms, and articulating it into a summary that makes sense for the physicians. So in this process, the summarization piece is primarily proprietary. It's almost 100% custom built from the ground up. But one thing that's interesting that we've seen as an industry trend in the last 18 months is the advent of transformer-based networks. So you have GPT-3 and T5 and others that have really proven to the world that AI writing sentences is not just robotic nonsense. It's almost better than and almost more real than what a human would have written in the first place. So the nice thing about our tech stack is that we modularized it enough so that we can actually switch out certain pieces that have had improvements in the past. So with this specific piece, you have natural language generation, and we've been actually able to swap a trained T5 model and our current model that generates sentences in and out, so that we actually get less robotic and more natural sentences. And this has really helped physicians accept our sentences more. So previously, a sentence that may have had all the concepts and all the information in it, but just wasn't written in the form that they would be happy with in their note, that sort of issue isn't happening anymore. And we've seen almost a 20 to 30% gain in the lack of edits, or 20% less edits with these new transformer-based generative models.
That's amazing. And again, that's why we like to highlight the technology that's being utilized in this case, in these different use cases on this platform, so we can share the good word with the rest of the world. So thanks again, Akilesh. Matthew, let's switch gears here, kind of wrapping up. But maybe you can share something from your career experience, especially there at DeepScribe that might be helpful for those looking to grow their career in tech or entrepreneurship?
Yeah, sure, Brian. I think if there's one piece of advice that I would give, it would be to really listen to your customers. I know people say that a lot, but I think listening to customers is very different than actually sitting down, hearing them, and letting them drive your product design process. A lot of the stuff that Akilesh shared earlier were, gems along our customer discovery process that we had to find out by talking to customers. Both Akilesh and I are not physicians building products for physicians. And a lot of the insights that we have specifically around the no customization piece and the preference profile part of the product that Akilesh was describing earlier was all derived from hundreds of conversations that we've had with physicians. And I believe that, it is those gems and it is a lot of those ideas that came out of those conversations, really hearing the feedback from these physicians that has allowed us to create a product that really works and a product that physicians truly embrace within their workflow.
That's amazing. I appreciate the share on that. And I can tell between the both of you, and I know there's 3 founders for this company, but you all have this passion to make the healthcare provider's life better, and in turn, obviously making life better for patient care. So thank you so much. And gents, it was a pleasure having you on today, and I look forward to speaking with you real soon.
Thanks, Brian.
Absolutely, Brian. Thanks for having us.
Bye for now.